Hi, I'm Melanie. I am the owner of Trauma Therapy of Nashville, and I offer trauma therapy intensives to individuals. So one of the first questions we explore is now the right time for your nervous system to do a trauma therapy intensive? I like to use a medical metaphor because I think we can all relate to it, is when we get sick, we might get an infection and we might spike a temperature. You got to deal with the temperature before you can then deal with the infection, and then maybe go deeper into what was the root cause of it. So when we're thinking about trauma therapy and doing deeper trauma work, we got to look at where in the healing process are we. We look at symptom management. I call it the Tylenol phase because we might take Tylenol to help with the temperature, is learning coping skills to manage like what's feeling so unbearable. So I'm looking for, do we have ways that we can self-soothe and ground ourselves? Do we have coping skills to manage like our big emotions and feelings? Because we learn a lot of ways to shove that down as a survival skill. So we're looking at how well we can do that right now. And then when we kind of get our symptoms under management, we look at, the understanding. How well do we understand the impact our trauma has had on us? How's it affecting our relationships and the way that we think and view ourselves? And so we're learning our core beliefs about ourselves. We're learning to shift our behaviors, and we're learning to set boundaries. And then when we kind of get a grasp on that, then we're going to move into the deeper work where trauma intensive might come in, because then we're going to go into surgery. We're going to dig into these things, these rooted things, and we're going to help the body release these things that are there getting triggered and causing some real disruptions in our life. And just like with surgery, you wouldn't take someone to the surgery with a temperature or with an infection. You kind of have to meet everyone where they are. And so that's what I love about the work that we do here at Trauma Therapy of Nashville. We've got therapists that understand that framework and are really good at identifying where are you in that healing process and coming and meeting you where you are. So if you're in the very beginning of your journey, that's great. You're going to have a trauma therapist that is going to help you start moving through that process. I'm someone that's coming in when it's time for surgery. That's what I'm really good at, and it's what I love doing. And so that's where how we explore where are you in your healing process. We just want to give your nervous system the best chance it has to making it through the digging deep and getting out on the other side to where it feels manageable. I feel like it's a very trauma-informed way to try to process and work with someone. We all have trauma. It's really just about where are you in your process and how can we meet you in that.